It is with great pleasure that I present this study at the 5th Asian Population Association virtual conference. The topic of the study is that non-communicable diseases and behavioral risk factors of the elderly population, a self-reported case control study of elders in Colombo district, selecting two diseases, hypertension and heart diseases. I'm Jayaratne, attached to Department of Demography, University of Colombo, Sri Lanka. During the 21st century, the share of elderly population of the world has increased steadily. Population aging in Sri Lanka is accelerating at a faster rate than the other South Asian countries. In 2012, 12.4% of the population were above the age of 60 years. At the present, many countries, including Sri Lanka, that we can see that we are experiencing the third stage of epidemiologic transition, which is the phase of degenerative and man-made diseases. And the emergence of non-communicable diseases is the pioneer of this space. Cardiovascular diseases, cancers, diabetes, respiratory diseases, and hypertension, these are the leading causes around the world in this context. More than 80% of the deaths reported in Sri Lanka have occurred due to NCDs, according to WHO records in 2020. The non-communicable diseases are highly affected by behavioral risk factors, such as use of tobacco, alcohol consumption, improper diet, physical inactivity. There is a growing recognition of the importance of health plays in advancing global health and sustainable development goals. Goal number 3, good health and well-being explicitly discuss the importance of paying attention to the NCDs in each and every context. One of the target specifically says by 2030 reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment and promote mental health and well-being. This table provides information on the hospitalization and hospital deaths and case fatality rates for selected NCDs. Considering essential hypertension, it can be seen that the female hospitalization is significantly higher compared to the males, also an increase when comparing 2016 and 2017, both for hypertension and also for the heart diseases. The next table, this provides information on morbidity statistics by age and sex. For the year 2017, you can see both diseases, hypertension and heart diseases, that are, if you are considering the old age group, which is 70 plus years, higher percentage of deaths have occurred due to heart disease and hypertension. Although the literature reveals the association between non-communicable diseases and behavioral risk factors, less attention has been paid to identifying the level or the strength of the association. The objective of this study is to identify the association between hypothesized risk factors with hypertension and heart diseases. At present, Sri Lanka is experiencing the third stage of the epidemiologic transition. As a consequence, there is a visible increase of the NCDs in the society. Furthermore, although the life expectancy of the population has increased, there is an emergence of an elderly population suffering from long-term NCDs. The respondents of the study are categorized as elderly persons with disease and the control group of disease-free individuals. In order to measure the association between disease and behavioral risk factors, hypotheses were tested. In the process of data collection, a questionnaire was administered. 90 control individuals and 90 cases for each disease were sought from patients visiting two medical institutions, a public hospital and a private hospital. Sample was selected from those who came for the checkups of the above mentioned medical institutions using the purposive sampling method. You can see these are the cases and control values which received for hypertension and behavioral risk factors by for the diseases. So this is for the heart disease and behavioral risk factors by cases and controls, the values received. As described in the methodology, the association between the disease and the risk factors has been measured through hypothesis testing. The null hypothesis can be identified as there is no association between the factor and the disease, and the alternative would be there is an association. Results revealed that the hypertension has different levels and association with different risk factors. The data collected through case control study has been utilized to run chi-square analysis. 95% confidence intervals were created to check the significance of odds ratios. You can see this table. There is a significant association between hypertension and smoking. We conclude the odds of getting hypertension is 4 times higher for people who smoke compared to those who don't smoke. Significant association between hypertension and diet could have been noticed. Odds of getting hypertension is 2 times higher for the people who are physically inactive compared to those who are physically active. It concludes that there is a significant but comparatively low association between hypertension and physical inactivity. Odds of developing heart disease for a person smoking is 4 times higher than that for a person who is not smoking. In the aspect of balanced diet, odds of developing heart disease is about 2 times higher for persons who is not taking balanced diet compared to a person who does take balanced diet. To conclude, it can be said that odds of getting hypertension is 5 times higher for people who consume alcohol compared to those who don't consume, and odds of getting hypertension is 4 times higher for people who smoke compared to those who don't smoke, and a significant but relatively low association between hypertension and diet can be seen. Odds of getting hypertension is 2 times higher for the people who are physically inactive compared to those who are physically active. Considering heart disease, it has been noted that the smoking and not having proper diet are significantly associated with heart diseases with relatively high impact. Odds of developing heart disease for a person smoking is 4 times higher than that for a person who is not smoking. In the aspect of diet, it is 2 times higher for a person who is not taking balanced diet compared to a person who does take a balanced diet. Suggestions: importance of having awareness programs related to NCD health, particularly on hypertension and heart diseases, which emphasize the behavioral risk factors and that it is necessary to implement such awareness programs at a macro and micro levels. These are the references. Thank you very much for your patience. Thank you very much.